Hi everyone, this is Neil, also known as the Wax Whisperer. Thank you for tuning in to my latest video. For anyone who doesn't know who I am, I'm a UK award-winning consultant audiologist and clinical ear care specialist. I specialise in the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance disorders. And also as a clinical ear care specialist, I specialise in the removal of impacted earwax and infected discharge and debris from the ear canal. I'm also the co-founder of ClearWax and we provide international training in endoscopic earwax removal. In addition, if you're a member of the public in the UK suffering from earwax, looking for a suitably qualified earwax removal specialist near to you, please visit our website www.clearwax.co.uk. So we have a client here who attended with bilateral impacted earwax, and as you will see, it's more so once I've removed the wax and as I get deeper into the ear canal, his wax was very, very dark. In fact, it was almost black. If you've been watching a lot of my procedures, you should be aware that the darker the earwax generally means it's been in the ear canal for longer, it's oxidized, and you can compare it to an apple or an avocado. Once you've cut into it, it oxidizes and turns into a black color. This particular client, it was actually his wife that booked the appointment for him. He was not able to hear on the phone, and let's just say his wife wasn't too happy. The gentleman had left this problem ongoing for a few months now, prior to lockdown even, and it got to the stage where I think his wife might have divorced him if he didn't get any treatment and have his ears cleaned. You can see the wax is quite stubborn, it's quite matted as well. There is a few hairs at the entrance of the ear canal. I know in a lot of the comments sometimes that I read, people always question why don't we trim or cut these hairs. The truth is, with these hairs, they're a slight nuisance, but it's not affecting me in any way. And if you do cut them, they're just going to grow back, and sometimes they grow back thicker and firmer, and it can cause more issues. The only time where I've ever needed to remove hair from the entrance of the ear, and we call the hair cilia, is if there's so much where it's completely obstructing the view. And in that circumstances, what I generally do, I use crocodile forceps and pluck the hairs. So I'm just trying to get it from the roots. It's not often that we need to do that, but there has been circumstances where the ear canal just looked like a forest of hairs. It just could not see behind the hairs. But in this case, it's only slightly obscuring the view. It's not a massive nuisance for me. I can appreciate if you're viewing this for entertainment and the hairs are in the way, you may not enjoy it. But obviously this is a clinical procedure. We try to avoid doing procedures that are not necessary and not deemed required, and in this case it certainly wasn't. So the client had been using some olive oil earwax drops for the last week or so. So at first I was going to put some drops in, but the outer layer was slightly soft, it was slightly softened with the drops. So my idea here was to get this outer layer out, and once I'm more medial, so further in the ear canal, then to put some drops in. I was using a combination of an ear hook and a Jobson horn, and you will see as during this procedure, and especially on the client's left ear, this is his left ear, using the ear hook in particular to chisel segments of this wax before then vacuuming it using the Zollner suction probe to remove it. You can see just how impacted it is. You can compare it to almost like a chewing gum that's been stuck under a chair or your old school desk. This is also impacted on his tympanic membrane, the eardrum, and you'll see that a bit later as I remove this layer of wax. You can see how stuck it is to the eardrum. So I've just created a bit of a gap at the top, so I've just tried to insert the Jobson, so it's an ear hook, trying to get in behind there. The gap unfortunately wasn't large enough, so I'm just going more towards the centre of the wax, just trying to chisel that, and then going back in with a Zollner suction probe to vacuum any loose ends. And this is quite common in earwax removal procedures. You just don't rely on one instrument or tool. You use instruments in combination quite often. And the procedure in total, I think it took me about 20 minutes to do both ears, and I would say the average is probably 5 or 6 minutes per ear. But in this case, as I said, the wax had been in there for a long time. It was really impacted. You can just see how black it is now. I mentioned at the beginning of the video. And you can just see where I'm trying to pull this wax down. You can see the layer of keratin. I've got the suction probe onto that at the moment. And that keratin, you can always compare it to double-sided sticky tape. It's stuck to the wax, but it's also stuck to the ear canal wall, and we just have to try to tease that off the canal wall and able to remove the wax. Just gone back in with the ear hook. Again, just slicing this into little pieces, and as it's sliced into little pieces, I can then go back in with the micro suction probe, Zollner suction probe, to vacuum any loose bits that I've created. I think in a minute I'll be also be using some olive oil drops, but I think before I do, you will get a view of the wax being stuck to the eardrum at the top, at the roof, and I think that will come up in a moment. So you can see the wax has, it is coming out in little pieces. On occasions, because the wax was a bit sticky as well, the patient had been using a bit of drops prior to attending, it was blocking the Zollner suction probe. And what we do then, you can normally identify that by a change in noise. The suction probe goes very quiet, and we use a cleaning rod. And that's where the wax, if you just look at the top of the ear canal, that's where it's stuck to the eardrum. Hopefully you'll get a better view in a moment. So the idea here is it's just to create some space around the wax, around the canal wall, so when I do put some olive oil earwax drops in, it can seep through and behind the wax and trying to get in behind the wax and the eardrum that's stuck onto it. So I've just gone anteriorly there, just trying to create some space for the drops to go in. I think in a moment you'll get another view of the wax being stuck to the eardrum. You can just see how elastic this wax is. As I'm trying to vacuum it forward, you can probably saw the wax stretching almost. It's similar to a piece of chewing gum, hence why I compared it to chewing gum earlier. And you can just see that just there, you can see the eardrum, just the top part, and the wax is really impacted on it. When you do use drops, you need to get the timing right. If the ear is completely blocked from the entrance to the eardrum, those drops are just going to help loosen the outer layer of wax, but it's not really going to penetrate deeper in. And in this case, the patient was already used some drops prior to attending, and it was the wax that was more medially that required the drops. And again, I'm just trying to loosen this, elevate this from the canal wall, just retract it away from the canal wall just to loosen it. And you can see I'm just making gentle concentric circles with the Zollner suction probe, and those little wriggle movements help just loosen the wax off the canal wall and also the eardrum, but you can still see it's still quite embedded onto the eardrum there. And slowly but surely, again, I'm just really loosening this, trying to get a suction grip as well, and then just wriggling this wax laterally, so away from the eardrum and towards the ear canal entrance. And then you can start to see it peel off the eardrum now, just at the roof superiorly. And again, I'm just, with the Zollner suction probe, I'm actually going beyond the main bulk of the wax towards the eardrum and gently stripping this off the eardrum. And once you've loosened it off the eardrum, it should all come off in a big segment. That wax there is in the anterior recess region of the eardrum. So the anterior recess is a little trench, a cravat, almost like a blind spot where the ear canal, and there's a kind of, it's almost like a little hideaway, a little cave there. And the anterior recess, so the word anterior means towards, in the case of an ear anyway, towards the nose. So the front part of the ear canal, and posterior means the back part of the ear canal. And now that I've loosened that off the eardrum or semi-loosened it. I'm just trying to get the big bulk of wax forwards. And you can just see there's a bit more stuck there at the back of the eardrum. So my suction probe got blocked there, so I just came out of the ear, used a cleaning rod just to push through the Zollner suction probe and clear any blockages. And throughout the procedure, the client was very comfortable. He tolerated the procedure very well indeed. I think he's learnt his lesson to get his ears cleared out more regularly. I did say to him when he goes home he's got no excuse for not hearing his wife, which I think at times he joked that he actually enjoyed the silence at home. And again, it is really stubborn, but I think we're going to be able to extract this now. There we go. And sometimes that's how you have to remove wax. It's just not as simple as putting a vacuum cleaner in the ear. We're not using a Dyson to vacuum the carpet at home. This is a delicate part of the body. Ear canals approximately 30 millimeters to 3 centimeters in length. The diameter's 8 millimeters. My endoscope is 2.7 millimeters in diameter, and the Zollner suction probe is 2 millimeters. So the two instruments itself take up more than half of the volume, the circumference and diameter of the ear canal itself. So, and there's loads of nerves in the ear canal. You've got the eardrum, obviously. You've got the bony portion of the ear canal, which is the inner 2/3, which is very sensitive. So I wish it was sometimes as easy as just putting an instrument in the ear, hooking it out. Sometimes slowly but surely wins the day. Just mopping up near the entrance there. You will see some coating of dead skin. The skin's not infected, so there's no clinical need to remove that. We've left that in there. That skin will now naturally shed and migrate. We now move on to the gentleman's right ear. He actually felt this was the worst ear out of the two, but when I removed the wax and compared the wax in the left and right ear, there's actually more wax in the left ear, I would say, than the right. So it's not always about the quantity of wax, it's sometimes how impacted it is, how compressed it is in the ear canal. Again, you've got a few hairs there. Yeah, a bit of a nuisance if you're watching, but for myself, it's not causing me any issues whatsoever. And as I mentioned earlier, if we do trim or cut those hairs, they're just going to grow back and grow back very quickly. So it's not going to really help the patient long term. Also, sometimes you run the risk of when you trim your hairs or cut them, that these hairs because they're loose, they fly into the ear canal and mat against the wax. So if anyone is at home trimming their hairs near the entrance of the ear canal, just recommend putting a ball of cotton wool with Vaseline just at the entrance, not too far in, because you will have to remove that cotton wool ball, and it just prevents loose hairs flying into the ear. When these loose hairs fly into the ear, they do mat against earwax if you have got waxy ears, making it very difficult to remove the wax. So again, you can just see how dark this earwax is. It's really dark in colour. It's been there for a number of years, no doubt. It's oxidised. Just loosening the wax from the posterior canal wall, and now from the superior canal wall, the roof, and now from anteriorly. Again, the patient had been using drops. You can tell by almost the gloss in the ear that is a bit oily there. Just going to the back of the ear canal there, you can just see where the wax is stuck against the ear canal wall, and there's a few skin adhesions there. I think with this case, I had to come out quite often and unblock the suction probe as it kept getting blocked. And again, the idea is just to remove this soft outer layer of wax that's already been oiled, and once that's removed, we'll put some olive oil drops in just to loosen the rest, and the more medial wax that's a bit more drier and impacted. So I think I'm going to be going in with the Jobson horn. So there's a bit of a gap at the top that I created. Because this more lateral piece of wax was a bit softer, I could insert the Jobson horn, I could thread it in between the space between the wax and the roof of the ear canal. And once I slided it in, I could actually then almost dig into the wax like exactly what I'm doing now, getting into the mid segment of the wax and leveraging and extracting this. If the wax was rock solid, it just wouldn't be able to, you wouldn't be able to penetrate the wax with the Jobson horn. It just wouldn't go in, it would be too hard. So I've removed the more lateral wax, just going with the on the suction probe. The wax is a bit drier here, so it's not as wet or sticky. Again, just trying to peel it off the canal wall a bit before I put some drops in, some olive oil drops. So there's different types of drops you can use that's available in the market, well, at least in the UK. You've got olive oil drops, you've got hydrogen peroxide drops, and you've got sodium bicarbonate drops. You could put them in two different categories. You can put them as oil-based drops and water-based drops. So obviously olive oil is oil-based drops. The benefits of olive oil is that olive oil is slightly acidic and earwax itself is slightly acidic. So it's a similar pH. Therefore, less people who use olive oil drops develop an allergic reaction, as opposed to sodium bicarbonate drops and hydrogen peroxide drops. Both of those drops are water-based, so in some people it can cause irritation and also set off an infection. Also, they are also alkaline in pH, and therefore that itself can cause a bit of irritation. So the fact that it's water-based and also alkaline, for some people, I wouldn't say a tremendous amount of people, but a few people who suffer from otitis externa, for example, so an infection, inflammation of the ear canal, generally recommend olive oil drops. I also prefer olive oil drops because I find olive oil, it works and acts almost like an egg in a cake mixture, whether it be a fish cake or potato cake. The egg binds the wax together. Sorry, the egg doesn't bind the wax together, but if you're making a cake, it binds all the ingredients together. And in case in the ear, the olive oil binds the wax together. So when you do remove it, just like I did a moment ago, it generally comes out in larger pieces. Sodium bicarbonate drops can make the wax very molten liquid state, and hydrogen peroxide drops I find makes the wax very mushy, making it very difficult, almost like mashed potato. You can imagine that's very difficult to vacuum and also remove by scooping and using an ear hook. Just some remnants at the ear canal. Again, is there a clinical need to remove this? It wasn't causing any difficulties, but just thought I'd hover over, just peel a bit of the dead keratin there. That will naturally shed. I know a lot of people enjoy watching skin peels. You generally only do skin peels if it is a clinical need. Sometimes you need to remove skin to help release wax, and also sometimes the skin can be infected. And you need to remove that dead layer of skin as much as you can, but it's not infected in this case, and that will naturally shed and migrate. I think I said in my last video, sometimes less is more. The client at this stage, his symptoms are alleviated, he's not experiencing any problems, and if we do too much unnecessarily and we cause injury or trauma to the ear, then we can be deemed clinically negligent. There was a bit of wax on the eardrum, however, which I could use with a fine iron very easily just to remove that. And that's the client's eardrum. You'll see there's a bit of staining there. That's normal, that's natural. I've probably got more wax in my ear than the patient. You've got 3 still images of all the wax. You can see there's quite a lot there on the tissue. You can see all the instruments I used, an ear hook, Jobson horn, Zollner suction probe, and a fine end attachment. I hope you enjoyed that video, guys. If this is the first time you're watching my YouTube channel, please do subscribe, like, comment on the video feed. Also select the bell icon so you'll be notified as and when I upload new videos. And if you're watching this on Facebook, similarly, please do follow the page, like the video, and watch all my other videos that are on my channel. Enjoy.